One of the beautiful things about Catch is because it's pan-Canadian and it's real-world treatment practice. So within Catch, the rheumatologist and patient is free to choose whatever treatment they decide is best. So that really allows us to look at, in sort of real-world practice, what's happening in Canada, and then to compare different treatment strategies that are being used across Canada. And one thing we've learned, we know that methotrexate works well, and it's our preferred first DMARD for people with rheumatoid arthritis. But there's lots of different ways you can use methotrexate. You can use it on its own. You can use it with other medications. It can be oral or subcutaneous. And having that sort of richness of data in Catch, we've been able to compare those different strategies. And what we found is that two strategies really seem to stand out, and that's subcutaneous methotrexate and using it at high doses. So, not higher doses than were used in the past, where people would start slow and sort of titrate it up. We know that if we start methotrexate at optimal doses right away, and the best way to do that is with subcutaneous methotrexate, we see better outcomes in Catch. And then the other strategy is with combination treatment, particularly triple therapy, which is 3 different medications together: methotrexate, sulfasalazine, and hydroxychloroquine. Those 2 strategies come out as somewhat better outcomes in people who use the strategies. It's not to say that everybody with rheumatoid arthritis needs those strategies, but that's what we've been able to do in Catch, is to compare these different approaches to how we use methotrexate. The other nice thing about Catch is we follow people long term, so we have lots of rich data extending 5, 10, Catch has been going on for 15 years now, so we've got good longitudinal data. And as opposed to, say, a randomized trial where things are very clear-cut, real world is a lot messier, where people have to change treatments and they may reduce doses, they may interrupt treatments for surgery or various things. So that's the really nice thing about Catch, is we can look over time to see how people do long term. And the strategies we found that work in terms of methotrexate strategies are, again, the subcutaneous intensive treatment with methotrexate, and so using methotrexate with other DMARDs. And kind of the message is, the earlier we get people under control, the better it is long term. One of the studies we've done recently is looking at side effects of people taking DMARD medication, so biologics and non-biologics, including methotrexate, whatever medications they were on. We asked people to just report back in terms of what side effects they're experiencing. And it was unique because oftentimes side effects are collected from the physician. So sort of the physician or the researcher's interpretation of what side effect happened. So we were interested in asking people taking the medications, what they were experiencing. And we found a fairly high rate of people reporting some side effects with medications. And I think what that tells me is that, they're still taking the medication, so they're not at a point where the person decided they needed to stop taking the medication, but just, I think there might be a unrecognized burden of side effects out there. And again, I think opening up that communication, sort of educating rheumatologists that's out there, and then encouraging patients to bring that to the rheumatologist, encouraging rheumatologists to ask about side effects, because again, if we don't know about it, it will just continue. We don't know what to do. And the other thing is, if we understand it better, we can sort of learn how to better sort of manage side effects in people taking DMARDs. I would say, so in people who are taking methotrexate and having side effects with it, the first thing I would say is there's usually lots that can be done. So make sure, if you're a patient taking methotrexate having side effects, make sure you talk to your rheumatologist about it. Sometimes it's sort of tricks in terms of what time of day you take it, splitting the dose, taking it with folic acid, or sometimes leucovorin, which is a sort of special folic acid. We try a lot of those things first. If people are still having a lot of side effects and their rheumatoid arthritis is doing really well, sometimes we can lower the dose, and that can find sort of the nice balance of minimizing side effects while still keeping the rheumatoid arthritis under good control. So lots of things that can be done. Really important that the patient speaks to their rheumatologist and has a discussion about it.